Welcome back everyone, Dr. Naveen here from UPSC Medico. So in this video, I'll be focusing on very important point, that is what are the updates which are happening in the preventive and social medicine or PSM updates. So this video is for year 24-25. So in the next year also I'll be doing this video. So I have decided that every year, whatever the changes happening with national health programs in India, okay, the health system, healthcare delivery system, health infrastructure, nutritional programs, mother and child health programs, national health public standards, okay, any statistics, MMR, IMR. So all these things, whatever updates happen, I think I have decided to notify to all my aspirants with the help of the video. As in 2024, we are also entering into coaching of UPSC CMS. So we have announced a video course exclusive for CMS. What I observed is, while making content for the preventive medicine of CMS, it is entirely different from a regular NEET PG Next or INSCET exams. The reason being, there's so much of weightage to all these health programs in that. And even nowadays, in prelims of UPSC civil services exam also, I could see 2 to 3 MCQs on national health programs. Okay, direct. For example, if you take last year, in the prelims, they asked a question on JSY, Janani Suraksha Yojana, and previous to that, they asked a question on Vande Mataram scheme, and also they asked a question on Anemia Mukt Bharat. That means even the prelims for general students, not only medical science students, general students also, there's a lot of focus on national health programs because India is spending a lot of money into health infrastructure and development. A lot of programs have come up recently. You might have seen interim budget 2024 by Nirmala Sitharaman ji. She has announced that there should be preventive education to encourage cervical vaccines in age group of 9 to 14 years adolescent girls, right? So there are a lot of things happening in the health segment. As a UPSC aspirant, mainly for medical science optional of UPSC, there is a PSM exam, right, in paper 2 section 2. There are a lot of questions on health programs which are current updates. Similarly, there's a lot of weightage to combined medical service exam also. In CMS, for students, it is a bit difficult to keep track of all the things, but again, to be the master of it, even they also have an interview, right? For medical science optional and CMS, there is an interview, and there will be some questions on national health program because the interview board is from CGHS. They are aware of all these things from Ministry of Health and Family Welfare. To have this knowledge will also help you in interview for medical science optional and also CMS, and also it helps you solve a lot of MCQs in CMS. It helps you answer most updated questions from the medical science optional answer writing exam. So in that way it is helpful. And even if you are an aspirant of NEET PG Next or INSCET, Institute of National Importance, nowadays government is taking up a project of improvising the health infrastructure in medical colleges and also establishing a lot of aims, right? All India Institute of Medical Sciences. So even if the question paper is of Next or INSCET, there is a lot of weightage for all these health updates. So never undermine or underestimate the preventive aspects of medicine, because there is a lot of focus from government perspective into it. There's a lot of weightage into it. So this video will tell you what are all the updated programs which have come. I'll not be getting into the details of all these updates. The reason being, all these updates are covered in the course. Okay, as a part of videos and notes, I have updated everything, and there are some things like which are not that important for exam point of view, like healthcare budgets. Any program which is not in the syllabus is in the article section of UPSC Medico. So I'll be posting the link in the YouTube video in the description of UPSC Medico article section. You can find some interesting updates related to national health in that article section, so that you keep in touch with what is happening with the healthcare system of India. Very important. Now let's begin our discussion. To start with, first and foremost, what are the PSM updates for 2024 in National Nutritional Programs, Maternal and Child? First thing is National Nutritional Programs, other is Maternal and Child Health or NRHM, and other is the regular National Health Programs for communicable diseases. So what are the diseases India is focusing upon and what is there in the syllabus? One is tuberculosis, malaria, Kala-Azar, filaria, HIV, AIDS and STDs, and also dengue. First important thing is dengue. There hasn't been any change so far. Okay, still dengue is an urban disease, and there's a lot of under National Vector-Borne Disease Control Program. Lot of things are happening, but one major change is effect of global temperature. Effect of global temperature on extrinsic incubation period of mosquito is topic of interest nowadays. Okay, and also any mosquito control methods can be a future question. Okay. mosquito control method. In the recent prelims, I have seen a question on Wolbachia method. Wolbachia. Okay, bacterium which is helping in mosquito control. So these kind of biological methods for mosquito control can be a future prospects. Apart from that, from strategy wise and all, there's not major updates from dengue point of view or dengue national health programs. That is National Vector-Borne Disease Control Program. Lot of focus is on mosquito control methods. With regards to HIV, AIDS and STD, yes, there is a major change happened. This is very important for you to understand, which can be a potential question in the future. Sampurna Suraksha strategy has come up. See, what is the key difference here? Previously, we used to focus only on those population group which are at risk of contacting STD, or HIV or AIDS, like prostitutes, commercial sex workers, let's say, homosexuals. So these kind of high risk behavior people only we used to concentrate. Now Sampurna Suraksha strategy is even for low risk strategy people also. Okay, so I'll not getting into the details, but latest development which happened in NACO, National AIDS Control Operation, right? So in that we have Sampurna Suraksha strategy, and one more change happened is globally there is a global AIDS strategy 2021-2026. So what are the targets that are to be achieved? It's been updated in the notes of PSM UPSC Medico. And then what we have is very importantly from the filaria point of view, which can be a potential question in the future. So I'm expecting this next year, because in filaria the government has released a 5-pronged strategy for elimination of lymphatic filariasis. There are 5 strategies which has been released and it's updated in the notes. Okay, so that we can eliminate filaria by 2027, 3 years ahead of SDG, Sustainable Development Goal is for 2030, right? Similarly, Kala Azar, government thought of eliminating by 2020 but 23, but we haven't reached that yet. Now we have a new deadline of 2025, but what are the steps towards elimination of Kala Azar by Government of India is very important, and this been included in the UPSC Medico notes. Now malaria we did discuss, this is very important, and this question has come in the recent exam. That is, what is National Framework for Malaria Elimination 2016 to 2020. So they might not ask it again, but we have a national framework for malaria elimination till year 2030. So make a note of it. This change happened in malaria and it's included in the notes, and it's a part of the video discussion. Now importantly, TB, you have to focus. Very important thing is happening. If you open Ministry of Health and Family Welfare website or social platforms, daily they will be posting a new celebrity who is a part of Nikshay Mitra. What is this concept of Nikshay Mitra? That now we are adapting TB patients and providing them with nutrition. Okay, Nikshay Poshan Yojana is also a new scheme from tuberculosis. National TB Elimination Program happened. We don't have RNTCP now. I had seen students even now writing RNTCP. There's no RNTCP. Now we have National TB Elimination Program 2022, and India has decided to eliminate TB by 2025 by fast targets, end TB strategy, which has been recently asked. But what is the major focus from TB from now on is, yes, definitely the MDR, XDR has been changed, and all these are covered as a part of the test series questions. And one more important thing is Pradhan Mantri TB Mukt Bharat Abhiyan has come, wherein we are focusing more on community support to the TB patients as a program called Nikshay Mitra. So all these are potential questions, and everything is covered in the addition to notes and videos. Nikshay Mitra, National Framework for Malaria Elimination, steps towards elimination of Kala Azar by now 2025. What is the 5-pronged strategy for elimination of lymphatic filaria by 2027? And what is Sampurna Suraksha strategy and Global AIDS strategy 2021-2026? And there's no major changes in dengue, but again you have to understand effect of global temperature on spread of dengue. Right, and dengue vaccines has come up in the market. What is the change which we see with regards to dengue? So we're done with important thing, that is national health programs related to communicable diseases from the syllabus point of view. Next thing is nutritional program. Now nutrition, the major change which is happening nowadays is last year India celebrated International Year of Millets 2023. So the millets has been given utmost priority. Even when our Prime Minister visited USA, like even the dinner for all the presidents whenever they come, is the millets has been included as a part of the lunch or a dinner. So that is the level of importance given to millets in 2023, and it's been continuing. Even millets are now part of midday meal scheme. Okay, we call it as Pradhan Mantri Poshan or midday meal scheme. Now this is one area where a major change happened, PM Poshan or midday meal scheme. Okay, a question has been asked in the test series to cover this concept. Similarly, Poshan 2.0. Now we have Poshan Abhiyan, which is mix of all the nutritional programs together. In the Poshan Abhiyan, Poshan 2.0 is mainly focusing on Poshan Vatika, that is establishing vegetable gardens in the vicinity to grow them and to give it to the kids and all. And there is a technical assistant to it. We call it as Poshan Tracker is also been included. Poshan Tracker. So these are the important developments that are happening with Poshan 2.0, which can be a potential question again. PM Poshan 2.0. And we had seen many questions in the recent past coming from Anemia Mukt Bharat, that is 666 strategy. We have a separate video discussion and also it's been included in the note. Anemia Mukt Bharat is very important. We call it as NIPI, National Iron Prophylaxis Initiative, or NIPI is also important. And we know every year the rank is getting down, the global hunger index. So just keep a note of what is the current global hunger index rank of India and what are the ways India is trying to improve it by spending a lot on national nutritional programs, community support, community involvement, Poshan 2.0, PM Poshan. These are all the things which are happening. These are updates. There are other national nutritional programs. I'll give you a list of national nutritional programs, but the major area where you need to focus for 2024 is this, and all these are my point of focus for discussion for test series. Now, maternal and child health is very important. Now, there is a lot of confusion for students from medical science optional. The difference between National Rural Health Mission, National Health Mission, National Urban Health Mission, and also what is this MCH programs? Are they part of NRHM? Are they out of it? And what are the questions related to healthcare delivery system of India? See, it's not easy to differentiate each of these programs separately, because if you understand how the administration is going on at the top level of India, if you follow the health budget very carefully, always there is a highlighted point by the finance minister saying that our motto is to bring all these bits and piece programs into a single roof or a single umbrella. So the government always tries to put all the schemes under a single umbrella. Now, the major body is Ministry of Health and Family Welfare, which takes care of national. First it started as National Rural Health Mission. Now urban component has come in. That's why now we only call it as National Health Mission. But still our syllabus focuses on only NRHM, but it will ask all the questions. Never they ask any specific urban health program, but still all the rural health programs are also implemented in urban health program. So it's better to name it as National Health Mission instead of NRHM, right? Now under this National Health Mission, we have this very importantly RMNCH plus A programs, right? Okay. Maternal, neonatal, child, okay, and adolescent health programs have been included under it. Under this maternal and child, we have separate category, that is MCH programs, which comes under the same umbrella of National Health Mission. So, but in the syllabus of UPSC, they have differentiated MCH from NRHM, but wherever it is possible, even our video discussion also, I have clubbed them together to avoid any confusion. Now, most expected development which is happening and most important questions which can be expected in the future are this. Surakshit Matritva Ashwasan initiative, that is Suman scheme, is very important because Suman scheme is a single umbrella or bringing all these programs like Pradhana Mantri Surakshit Matritva Abhiyan, Lakshya program, JSY, JSSK, they are all kept under, and Vande Mataram, they are all kept under one scheme of Suman initiative, so that proper care, respectable care with zero tolerance is given to all the pregnant women. So this is the major changes which are happening. Lakshya is also a recent change wherein the delivery care, that means the delivery rooms, operation theatres for institutional delivery have been upgraded. So it's a national health infrastructure related program. And we have PMSMA wherein there is I pledge for 9 on 9th day of every month. Quality antenatal care is provided to the women. So these three programs are future expected questions. Okay, future expected, because Vande Mataram scheme has already been asked. JSY Janani Suraksha Yojana is already asked. JSSK Janani Sishu Suraksha Karyakram is already asked. So these three areas wherein you have to focus because these are the latest developments. Now we have IPHS 2022 guidelines. Recently I released a YouTube video also on this. What are the new population norms for PHC? There is no more PHC. We have health and wellness centers now, which are both rural and urban. These health and wellness centers are not only PHCs. Even sub-centers are now health and wellness centers. It is to provide comprehensive primary health care. I will not discuss all these things in detail because I have uploaded a separate YouTube video on it. But what is more important is, yes, there is a change in guideline and there is a change in population norms. If you are preparing for NEET, next PG, or INSCET, or UPSC CMS, there will be a future expected question on for how many thousands of population there should be one PHC. Okay, one health and wellness center. So these kind of questions can come in the future from this. Now, next important thing is, very important thing is, what is national digital health mission? Because India is spending a lot on digital health mission from post covid era, right? So we have telemedicine setups which are happening in the PHCs. So national digital health mission from infrastructure point of view is the latest development. Similarly, yes, Ayushman Bharat in 2018, though it's an old program, it's still continuing. We have two segments in it: Pradhan Mantri insurance scheme and health and wellness centers. And most latest, a lot of questions are coming on CMS, which can be a future question even in medical science optional. That is homeborn care of young children by ASHA worker. Homeborn care, because homeborn care of home based care of newborn. HBNC is already been asked, but now we have home based care of young by ASHA, which is most latest development. And from child health point of view, we have RBSK, Rashtriya Bal Swasthya Karyakramam, and Navjot Shishu Suraksha Karyakramam. These two are important latest developments with regards to maternal and child health. And a lot of questions from RBSK are coming in the UPSC CMS. It's a dictum topic for combined medical service exam. Now, this single slide is very important. Take a screenshot of it. 1 or 2 or 3 questions might pop up from this slide, either in medical science optional exam or combined medical service exam or INICET, wherever it is possible. And all these things are covered in our course. Okay, you don't have to worry about whether will I be able to get all the updates. Yes, all have been updated in the addition to notes, and the videos have been uploaded, and some of the unimportant ones are already been uploaded as a part of article section of UPSC Medico website. So we covered everything. If you're attending interview also, these are the things that you need to focus before going to the interview. Now, for CMS prelims and interview, these are important, but for medical science optional answer writing exam, these are not important. But again, you can use NFHS 5 fact sheet about what is the latest IMR, what is the latest under 5 mortality rate, what is the contraceptive usage percentage. So these kind of things are important for exam, but more or less it's important for interview. As I told you, millets, International Year of Millets is very important. It can be a potential interview question or a UPSC CMS question. We also have organic medicines going on in the market from health perspective. So Pradhana Mantri Bharatiya Jan Aushadhi Pariyojana, wherein there is an encouragement for generic medicines. I'm so sorry, generic medicine program, PMBJP, very important. Just go through it in the article section of UPSC Medico. And healthcare budget updates. Now we have a national sickle cell anemia elimination mission in tribal areas, that is 2047. Cervical cancer vaccination has been given encouragement, so you might expect a cervical cancer question in OBG part of UPSC medical science optional. So Saksham Anganwadi centers have been upgraded nowadays, and also from mission Indradhanush vaccination point of view, there is a technical platform called UWIN platform which is introduced, which is out of the syllabus again, but hypertension control initiative has been, the guidelines have been released by Government of India. So these are some of the updates which are not that important, but just make a note of these things. I think this one slide too. So there are hardly 20 updates. So when I explain all these things, you might feel that, "Arey, kya ho raha hai PSM se? Is it? Can we do it?" You can definitely do it, but you need a continuum. You have to understand. So that's why what I did on videos of all the national health programs, I start with chronology. I'll tell you what happened in 1956 UIP, then uske baad how we get into immunization schedule, national immunity, then after what are the changes. So this is how I continue my videos. So watching videos is more important than just going through the updates of the notes. The reason being, if you don't have a chronological understanding, you will not understand what are the changes that are going to happen. For example, this level of understanding took me 3 to 4 years of constant touch with UPSC medical science optional PSM updates. If I don't do that, if I just start on day one, I'll also feel that what are the things that gonna happen. Will I be able to memorize or remember all these things? But as a medical science aspirant, right, you have a 2 years lengthy cycle. So even if you give clear also, you have to continue your preparation till next year. In these 2 years, if you keep in touch with PSM, I think it becomes easy for you to have a knowledge of all these things. See, this knowledge is very important for a district administrator. See, health is a major part, health, right? So hunger, health and all, they're all important elements of life. So keeping in touch with these things will put you ahead in all the aspects of UPSC. You can even improvise your general study answers with the health updates. So keep in touch with all these programs. They're very easy. Okay. Even if you feel frightened now, the things will change in the due course. If you follow the process, if you keep in touch with me, if you understand the demand of the exam and follow my course, and if you constantly in touch with article section of UPSC Medico, everything will be covered. You will not miss even a one point. I'm promising you that. Okay. Now, is there any program? I'm now giving you a list of actually what are all the programs in India do we have related to health. If you have that knowledge, keeping track of them is very easy. So we have National Delhi Digital Health Mission. We call it as telemedicine program. Okay, National Digital Health Mission. The lot of things, but telemedicine has been given priority. Similarly, we have Ayushman Bharat, as I already told you. Now IPHS 22 guidelines, and this is very important. PMSSY. See, in this PMSSY program, okay, PM's First Suraksha Yojana. First Suraksha means we have decided to establish lot of aims, almost 21 aims in India. That's why previously we used to have aims exam in medicine. Now we have INA-CET exam. So this INA-CET exam is not only for aims Delhi. We have started it plus 5 other institutes which are part of it, Rishikesh and all, right? So institutes of national importance have come even in medical sector. So it is a health medical education system strengthening program along with aims establishment. You might have seen, I think a few days back before recording this video, in the main Hindu paper there was a big advertisement from government that PM has inaugurated 7 AIMS colleges at once, seven AIMS institutes. So that means we are spending a lot of on super specialty care. Apart from that, even medical colleges has been getting strengthened from the health infrastructure point of view. So the detailed PMMSY article is there in the article section, and also the discussion video is there in the video course part. This might not be important from exam point of view, but because health system critically analyze, this is the topic, the lot of times questions have come. Critically analyze national healthcare delivery system in India. Okay, critically analyze PHC, critically analyze health and wellness centers. So these kind of questions are important. So you get lot of content for these kind of questions from these topics, that is PMSSY. Similarly, we have a Rogi Kalyan Samiti also, which is again a health system management program. Okay, just go through it, which is there somewhere in the notes, somewhere in the video. You will definitely find it if you are part of UPSC Medical. So these are all the national health programs related to health system strengthening. Now national health programs related to mother, as I told you, Janani Suraksha Yojana, Janani Suraksha, Sishu Suraksha Karakramam. Lot of students are getting confused between these two programs. JSY is only incentives for institutional delivery, whereas JSSK gives lot of entitlements. Okay, entitlements in the sense free transport, free vaccination, free drugs, free blood, even the kid is taken care here. And now most latest is PMSMA, Lakshya, Suman, and let's say family planning program, that is Mission Parivar Vikas, menstrual hygiene scheme, okay, and maternity benefit act, mother and child tracking system, which was 2019 previous year question. MCP cards are given to the women, and we have Vande Mataram scheme. So these are important scheme from mother's point of view. National programs related to child are very important topic from UPSC CMS, also from pediatrics. Lot of MCQs have come from this topic. To begin with, 1985, starting from Universal Immunization Program, National Immunization Schedule, Pulse Polio, Mission Indradhanush in 2024, Mission Indradhanush 2.0, 3.0, now we have Mission Indradhanush 4.0. All these are important from immunization point of view from child perspective. Long back we had diarrheal disease control program 1981, but we are not focusing on now. From 2014 it is modified into intensified diarrhea control fortnight, okay, IDFC. Not much important, that is, but what is more important from exam point of view, both CMS and medical science optional, is acute respiratory infectious control program, that is 1990. We still have, there are a lot of updates happened. So my notes and videos contains the latest updates related to ARI program, and if you are parallelly preparing for PG exam, you do realize the importance of how do you manage a case of no pneumonia, and severe pneumonia categorization, right? Very important, acute respiratory infectious control program. We have old programs like CSSM, Child Survival and Safe Motherhood. Then comes National Health Mission. Then the most latest what we have is RMNCH plus, reproductive, maternal, newborn, child and adolescent health. Okay, this is what we are continuing. Under this umbrella, we have a lot of programs, like what we have is RBSK. What we have is, this is very important, the new question has come in the CMS. You might expect in medical science optional theory exam in future. India Newborn Action Plan in 2014, and home-based newborn care, home-based care of young child, very important. These are roles of ASHA. Okay, ASHA is the prime pillar in these programs. And newly we have facility-based newborn cares. We have multiple facilities for the newborn care, and we already discussed even JSY, JSSK has related to child, but more related to the mother. Okay, and very importantly for our exam point of view, you all the updates related to IMNCA. You know, now we have FIMNCA, facility based IMNCA guidelines also available, and I have included this question in our regular test series. Now NSSK, Navajot Sishu Suraksha Karakramam, wherein neonatal care units have been upgraded, like how in Lakshya we are updating the delivery care units of mother. Neonatal care units, NICUs, all are updated in NSSK program. And finally, for management of acute severe malnutrition, we have national rehabilitation centers in India now. So these are all the national health programs related to child. That's it. Out of this, there's not even a single program which is left out. Even if it is left out, I will add it in the comment section, or for the future perspective, PSM Updates 2025 for next year also, I'll follow all these programs. I'll give you the updated content in our UPSC Medico course. Now finally, nutritional programs we already discussed, but just finalize them. First we have iodine deficiency control program, very important. For breastfeeding we have mother's absolute affection program, MA program. For fluorosis, which is again a nutritional program, we have national program for prevention and control of fluorosis. For anemia, iron, we have iron deficiency, national iron plus initiative, NIPI or anemia mukt bharat, very important. One topic out of this which can be expected again and again as a repeat is that. And national vitamin A prophylaxis program we have ICDS. Okay, we have midday meal, that is PM Poshan, and Poshan Abhiyan or Poshan 2.0. These are important. Poshan 3.0 has come, but still Poshan 2.0 elements are continued in Poshan 3.0. Okay, that's the major importance. So this will conclude our discussion on all the PSM updates related to 2024. I might have taken more time in making you understand all these things. Even if you don't watch this video, even if you don't understand at this point of time importance of all these updates, my course will cover everything, okay, including constant updates which are posted in my social platforms, the article section. So as a mentor of UPSC Medical Science Optional, it's been a while that I have realized the importance of keeping in track of all the national health programs, because most of topper students, they're struggling to keep in touch with these things, because apart from all these programs, you also need to keep track of the programs which are happening in economy of India, programs which are happening with the social programs of India, right? The lot of national programs which are not related to health. So to lessen your burden, the health program part is taken care by Dr. Naveen. So you don't worry about that. So I'll update everything, and I'll post update every update. 2024 has come, right? Next year I'll post 2025 updates. Every year I'll keep track of all these things, so you don't waste time or don't burden your brains on following all these things. I'll take care of that. You focus on regular programs. And my sincere suggestion to you is, if a doctor is writing UPSC exam, okay, I think even if it is a general study related answer, I think you have to bring in that health touch to your answers. That should be your unique selling point, okay, in these exams. So all the best for upcoming exams.